Christine. I'm the CEO and founder at Gabby. At Gabby, we're on a mission to decrease delayed diagnosis, starting with breast cancer. In 2013, I lost my mom to a preventable breast cancer due to a delay in diagnosis. My mom didn't know what her risks were and therefore wasn't able to take action soon enough. I, fortunately, exhibited similar symptoms, but I was able to discover my risks and take action. I knew after working in healthcare and after experiencing this with my mom and my personal diagnosis, that there had to be more women, younger women under 50, who were experiencing delayed diagnosis of breast cancer. And in fact, with a recent payer pilot, we confirmed our hypothesis. Over 26% of women under the age of 50 are being diagnosed with breast cancer. And 85% of those women are diagnosed at later stages when it is the most life-threatening and most expensive. Why is this happening? Well, it's because this is what it looks like today for a woman to discover breast cancer. Let's say her name is Zoe and she's 35 years old. She finds a lump. The first thing she's gonna do is talk to her mom, her sister, or her best friend. Then she's gonna Google it, and eventually she'll go to her physician and present this lump. But because she's 35, she doesn't fall under the medical guidelines for screening. So her OBGYN is going to tell her to just watch and wait. So she does that for 3 months and comes back 3 months later with the lump still persisting. Now her physician is going to begrudgingly order a breast mammogram, but it's going to be inconclusive because she's 35 years old with dense breasts. So she has to go back to her OBGYN, still with this lump, and finally her OBGYN will order a biopsy and diagnostic MRI, only to be diagnosed with stage 3 breast cancer 24 weeks after the initial finding. Obviously, this is incredibly costly for the woman, but it's also incredibly costly to the payer. But it's not just about Zoe. If we take a national payer in the United States, on average, about 20,000 of their female members under 50 are being diagnosed with breast cancer and experiencing a delay in diagnosis, costing them almost $2 billion annually. That's where Gabby comes in. Instead, Zoe is offered Gabby through her health insurance, and she's prompted to complete her risk calculator, where she learns that she has a 35.6% lifetime risk of breast cancer. Now she's given her personalized action plan, and Gabby walks her through those steps. Her first action is to learn how to perform a self-breast exam, and upon doing so, she discovers a lump. Now for the next 6 weeks, Gabby is going to track that lump and notify her when to check in and when it's time to go talk to her doctor. So 6 weeks later, when she goes to her OBGYN, she's able to communicate her lifetime risk and how her lump has persisted and worsened over time. Her physician is going to view her not as an average risk woman, but an increased risk, and therefore move to greater action, ordering an MRI and biopsy so that Zoe is now diagnosed at stage 0, only 10 weeks from the initial detection. How are we able to do this? Well, it's all in our inclusivity, accuracy, and our approach. Today, existing risk models are only used in clinical settings. And although they're in the standard of, although they are standard of care and in the medical guidelines, only 1% of clinicians are running their female patients through these risk models. So we're making our risk model consumer facing. Second, these risk models are really only appropriate for women who are over the age of 35 and white. So our risk model is for all ages and for women of all ethnicities. And then third, even these risk models today in standard of care are not that accurate. They float around 60% accuracy. And I'm happy to report that our risk model is 23% greater in accuracy than any existing standard of care model. So that now, instead, with Gabby, we are improving health outcomes, decreasing the time to diagnosis, and decreasing the cost of diagnosis. We recently just completed a pilot with the second largest national payer and have moved into procurement. With this payer, their numbers are on the left-hand side, that they're experiencing about 13,000 women who are experiencing a delayed diagnosis of breast cancer under 50. But with Gabby, we can bring that number down more than in half. The cost of those 13,000 women for this payer is almost $2 billion annually. But with Gabby, it's only $810 million. So in total, we're able to save this payer over $400 million annually, which is why we've entered into contracting with them to roll out nationally to their self-funded and fully insured accounts. We also just recently closed our oversubscribed pre-seed round of 1 million, and we have all 5 big national payers in our pipeline. We have a really strong team of experts from industry leaders like Myriad Genetics, Nike, Cambia Health Insurance, and IDEO.